A 35-year-old patient is reviewed in the night before elective inguinal hernia repair and found to have a blood pressure of 170 upon 95. He's a long-distance runner and reports no known medical problems. Concerning his management, what is the most appropriate next best step? So give this a shot as well, and let's see what you guys think. Alrighty, I'm seeing one answer so far. Just giving you guys a couple more minutes. Think about it. Well, not minutes, seconds. Alrighty, cool. So I'm seeing A and I'm seeing D. We're gonna go through it, right? So let me just read through the question with you guys, just point out the important things. So first of all, it's a 35-year-old man. Let's start there. Well, not man, it's just a 35-year-old patient. We don't know if it's a man or a woman. But the person is 35. Always pay attention to your ages as you do questions as well, right? So always pay attention to your age. So it's a 35-year-old patient. It's the night before an elective inguinal hernia repair. So it's the night before they're 35. And the night before, all of a sudden, the blood pressure is high. And it's really, really high, right? Then it gives us a little bit of context about the patient. So it says he's a long distance runner and the man never ever have a medical problem, right? So him run long distance, him not have no medical problem of note. End the discussion. So one of the things you have to be thinking about is first, I know we have options. Let me see. Let me read through. It says B, request a chest radiograph. C, start an ACE inhibitor, proceed to surgery. D, order preoperative troponin. And E, start a beta blocker and proceed to surgery. So let's address option D first. Option D is suggesting that we do a preoperative troponin. Remember, troponin is it's one of those enzymes that you're testing for to see if the person has a heart problem, right? So troponin, it's very sensitive for any form of cardiac insult because the cardiac cells, when they're permanently damaged, they secrete troponin. This person, they're 35, they do long distance running, and they have no known medical problem, right? So you wouldn't necessarily want to think about, okay, they have a heart problem because it's a hernia repair. They're perfectly healthy before. You wouldn't expect them to magically develop a heart problem overnight. So option D, order preoperative troponin, that wouldn't be the case. So this particular question is a first order question. It's either you have an idea of what it is or you don't, but I'm going to go through it still. The next option says request a chest radiograph. That also wouldn't be the answer because what can a chest radiograph tell us? Chest radiograph could give us an idea of, it could tell us if the person has any form of lung problem. So it could give us an indication about the lungs. So it could say whether they have a pneumonia or something along that line. A chest radiograph could also tell us, well, obviously stuff about the ribs and all of that crap, but we're not focused on that. It can also tell us something about the heart, right? Chest radiograph could tell us whether you have cardiomegaly, meaning big heart, or if you have something related to the heart that's causing a heart problem, where they have a restrictive heart disease, it can actually show up on chest x-ray. But chest radiograph, it wouldn't help us here because we're not anticipating or expecting a young patient. I don't know why I keep saying is a man, but we don't expect a young person to be having a heart problem, especially when they exercise. So what we're thinking that could be going on is the person is stressed. It's the night before them surgery, and then probably I say, boy, doctor gonna cut me open, and him probably gonna lift out my intestines, him gonna do this, him gonna do that. Suppose him accidentally cut something, suppose me dead, right? So usually in cases where a person is very anxious, so anxiety, when a person has anxiety, right, they can get certain cardiovascular changes as well as respiratory changes. So for example, if we're thinking respy, they can have increased respiratory rate, right? If we're thinking cardio, during anxiety, they can get increased heart rate, otherwise known as palpitations, so they can feel their heart racing. And in addition to the heart racing, they can also get an increased blood pressure, right? So all of these things come into play when you have anxiety. So that's what this patient is having here, right? Now, we have an idea of what the picture is, but let's look at the other options. Option E says start a beta blocker and proceed to surgery. Now, a beta blocker, we all know it targets the beta receptors on the heart. And when you target the beta receptors on the heart, it blocks it. By blocking it, all beta blockers can decrease heart rate, and also it can decrease the blood pressure a little bit, right? However, it's the night before the surgery, right? So usually the night before the surgery, you don't want to start someone on a beta blocker the night before the surgery. Because if you give them beta blocker the night before the surgery, then they go on to do the surgery, it can cause problems. It can cause certain compensatory problems, etc. So usually, if you're starting a patient on a beta blocker, you want to start them at least a couple of days before. So no, option E can't work. You can't start them the night before. Cool? And start them on an ACE inhibitor. Well, that don't make no sense either. But ACE inhibitors do decrease blood pressure, right? We're not going in that pathophysiology right now. That's for another day. But ACE inhibitors can theoretically decrease blood pressure, but you wouldn't use it in this particular scenario. So you can rule out option C. So the best answer is to give them an anxiolytic, meaning something that will soothe them, stop the anxiety, and then you can proceed to surgery, right? So best answer here is A. Give an anxiolytic, proceed to surgery. So you can give them like a benzodiazepine, can give them something like midazolam or anything along that line, make them calm down, and then, you know, you operate on them afterwards. When you lower the anxiety, the respiratory rate will go down, the heart rate will go down, and the blood pressure will go down, and then you can operate on them. So this is a perfectly healthy guy. So we're moving on.